for members of the media, our media partners, to ask questions. As you all already know, Facebook is where we offer the public and we encourage the public to ask their questions. So this is a platform for the media only today. A recording of this particular news conference will be provided in a link in today's daily media release. Apologies, but today we are not allowing recording. So no need to ask permission to record, but we will again be providing a link. All right, let's get things started.
Recording in progress.
Thank you, Erica, and good morning, everybody. Let me begin today with a brief overview of the pandemic, then I will take your questions. The Omicron variant continues to cut a destructive swath through Oregon, fueling steadily rising hospitalizations, record-shattering daily cases, and a staggering test positivity rate. This is distressing for all of us. It has been 2 years of fighting this virus. We have lost family members and loved ones, friends, neighbors, and colleagues. We're all ready to move on. But by continuing the efforts Oregonians have done throughout this pandemic, we will get through this and continue to save lives. There is some light at the end of this very dark tunnel. The recent modeling suggests that cases could peak within the next week or so, with hospitalizations, a lagging indicator, peaking in the following weeks. More importantly, the forecast shows the difference all of us are making by continuing to take preventive steps. The projected peak for hospitalizations is about 1,500 in early February. Without the widespread adherence we've seen from Oregonians, the curve would be much steeper, about 1,900 hospitalizations. But the present outlook remains gloomy. Today, we're reporting yet another pandemic high in daily cases, 10,947. Yesterday, we reported 10,034. Our COVID-19 weekly report for the week ending January 16th reported a pandemic record 52,337 daily cases, 11% more than the previous week and 3 times higher than the previous week. That's 52,337 Oregonians sick with COVID, and that represents only those reported to public health. While we again recorded a weekly high for COVID-19 tests, the reported percent positivity hovers stubbornly at more than 20%. COVID-19 hospitalizations have risen sharply in recent days. Yesterday, OHA reported 60 new hospitalizations, and since Monday alone, there are 152 new hospitalizations, 159 new hospitalizations. That's 159 of our fellow Oregonians now in the hospital. Since January 1st, COVID-19 related hospitalizations have climbed 127%. Our hospitals, still reeling from the Delta surge, are now struggling under the additional stress of the Omicron onslaught. Earlier this week, we passed 900 COVID-19 related hospitalizations, and today we're reporting over 1,000 individuals with COVID-19 in the hospitals, and we're well on our way to eclipsing last fall's record highs. These increases are not sustainable. We must do everything we can to ensure that there are enough available beds for everyone who experiences a medical emergency or needs hospital care. We can do our part to ease the strain on our hospitals by getting vaccinated and then boosted when eligible, by continuing to wear our masks indoors and outdoors in crowds, and by keeping our gatherings small, staying home if we're sick or staying home if we test positive. I'm often asked about where Oregon stands in relation to what we're seeing across the United States. While cases in our urban enclaves have leveled somewhat, we are seeing surging cases and more serious illness in less vaccinated rural areas and amongst those who are elderly. But the critical difference here in Oregon is you. National data shows that Oregonians wearing masks in greater numbers than in other states and models show that more of us are limiting our travel and watching our gatherings. So I want to thank the vast majority of Oregonians who continue to take these steps to protect themselves, their loved ones, and our communities. Your actions have helped keep the death rate from COVID amongst the lowest when we compare ourselves to other states. Finally, I also want to thank the Oregonians who spoke at the public hearing yesterday about the mask rule in Oregon. Many people shared their thoughts about masks. No one likes to wear masks, and all of us would like to remove them and move on without needing to wear a mask to prevent COVID-19. Your comments are valued. When we all wear masks, we protect each other. As COVID-19 hospitalization rates in other communities who faced Omicron early show, and the most recent Oregon COVID-19 hospitalization forecast shows, we anticipate being in a position in the coming weeks when our hospitals are no longer as strained to provide care to the Oregonians showing up at their doors. We're a step closer to moving from changing plans because of COVID surges, a step closer to celebrating life's milestones with loved ones this spring, and a step closer to not having to wear masks regularly to protect the most vulnerable around us. We need to continue standing strong against the virus, to keep our hospital system viable, and to ensure that everyone who needs medical care can get it, whether you have COVID, need trauma care after a car crash, or specialized care after a heart attack. Let's continue looking out for each other, get vaccinated, get boosted if you're due, continue masking and limiting gatherings, stay home if you're feeling ill. And with that, I'm happy to take your questions.
Thank you, Dr. Seidlinger. I want to remind all of our media partners and friends to use the raise your hand function if you have a question. I forgot to mention that earlier, and so I'll just start calling on folks as I saw them pop up. And also the request has been made for this link to be provided before 2 p.m., which we will try to do. So our first question comes from Pat Doris with KGW. Go ahead, Pat.
I often do have a question, but actually today I don't. So sorry about that. I'll just continue to listen. Thank you.
Wonderful. Then I see Kellee Azar with KATU. You have a question. Go ahead, Kellee.
Good morning. Thanks for taking our questions. I have two off the top of my head. Well, actually three, sorry. So one of them is Washington State just announced that they will be offering at-home tests for residents through their website. They're going to be sending them utilizing Amazon as the delivery. Does Oregon have any plans to do that for Oregonians?
Thank you, Kellee. Currently, Oregon does not have any plans to distribute tests from the state directly to households. The federal government has a website where individuals can sign up and have 4 tests delivered per household. In Oregon, we have some home tests available that we are distributing to our local public health partners, our community-based organization partners, so they can get them in the hands of Oregonians who've been most impacted by COVID-19, who've had less access to testing. By using these partners on the ground, getting them tests to distribute in their communities, we feel we can reach the folks who need them the most, rather than set up a separate system to mail them to every household.
Thank you, Kellee. Our next question comes from Rachel Monahan. Go ahead, Rachel.
Hi. So this is a question I've been asking for a bit, but I think it was 2 weeks ago, Friday, it was a record-setting day. Maybe it's 3 weeks ago. Wait, I think the 7th, I believe, actually. Oregon had a record-setting day in terms of the number of COVID cases, but there was a small note on that release about how a bunch of tests were coming in that day. Can you give me the data on how many of those tests were positive that day and whether, that was a blip, at least? It was the first time we had hit 10,000 cases a day.
Yeah, Rachel, thank you for that question. I don't have the specific breakdown of the cases that day, but we did have a lag in reporting for some of those cases that have come in. Unfortunately, I think what we've seen over the 2 weeks since then is that was not a blip. Today, we're reporting over 10,000 cases. Yesterday, we reported over 10,000 cases. These are individuals not with lagging tests, but that have been reported in to Oregon. These do not include home tests that are not required to be reported in, or individuals who do not seek testing. COVID-19 is spreading rapidly in our communities. while we may see some early signs of potentially leveling off in our metro areas, cases will continue to be at very high levels in the coming weeks. We're also troublingly seeing hospitalizations continuing to increase. So that record number 2 weeks ago, unfortunately, was not a blip, but is a sign of what we're facing right now and what we all need to do to drive these case numbers down, getting vaccinated, getting boosted, wearing our masks, considering changing our plans while COVID is raging across the state. These are all things we can do to try and get this number back down.
Can you all get me by the end of the day how many positive cases were from the past, the past testing dump that happened that day? Because I've been asking for that for almost 2 weeks now.
What I can tell you is those cases that were reported, I don't have an exact number, and nor can we easily get that number on cases from previous days. But what we know is that 10,000 number was not a fluke. We continue to see daily case numbers over 10,000 because COVID-19 is surging across the state.
And how are you reporting the number of home tests that are reported to you somewhere?
We currently have 2 methods for individuals who do a home test to report those results to public health. For individuals who call on the phone and receive information from our hotline, based on the information received during that interview, they can be created as a type of case in our numbers. For individuals who report them into the portal, those are examined by our staff at OHA to determine if they meet the definition of a suspect case, and if so, if they can be counted. But home tests are not automatically included. We work with our epidemiologist and investigation team to determine if they meet the definitions for cases. What I want to say to individuals who test positive, individuals who are sick with symptoms of COVID-19, you likely have COVID. Stay home, limit your contact with others in the home for 5 days so that you don't spread the disease further, and then wear a mask regularly on the next 6 days, days 6 through 10, the next 5 days, days 6 through 10, so you don't spread the disease to others. Whether or not your case is reported to public health or not, treat yourself like you have COVID once you have that positive test.
So the home test numbers are included in your daily case count, if I understood correctly.
For an individual who tests positive at home, who reports that case into the hotline and completes an interview and meets the definition for COVID-19, they will be included in our daily case count. All cases are included in that daily case count.
And do you have a breakdown of how many home test cases are being included?
We do not. Currently, call volume, while it has increased, is still only about 100 per day. We anticipate that will go up as more people use that line to report in. But no, we don't maintain separate case counts for our positive tests that are reported in through laboratories, healthcare partners, or by individuals reporting in their home tests.
So ballpark, it's a maximum of 100 a day.
That would be the maximum because we are receiving about 100 calls per day through that hotline.
Thank you.
All right, great. Thank you, Rachel Monahan with Willamette Week. Okay, Pat Doris, KGW, he does have a question. Go ahead, Pat.
Yes, thank you. Dr. Seidler, can you talk about the number of tests that have come in now to the state from the federal batch that we purchased or whatever purchase we made, and how many of those have been distributed and generally where? Thank you.
Thank you, Pat. I think you're referring to the home tests that the state ordered. The federal government has a direct ordering process for households, and I don't believe those have started shipping yet, nor do we have those numbers. As far as the home test kits that the state of Oregon ordered, we've received 1,965,600 kits. Each of those kits contains 2 tests. The initial batch of those tests have been sent to our K-12 education partners, as well as our hospital partners to support staffing during this Omicron surge. We've had 109,980 test kits distributed to our K-12 education partners, and 799,920 tests distributed to our hospital partners for use in their staff to do testing to identify if they're sick and to try and return folks who are not sick and not testing positive to work. There are approximately 500,000 tests that are still in the hands of the Oregon Health Authority that are used to replenish those hospital supplies and K-12 supplies over the coming weeks. And we anticipate approximately, an additional 260,740 tests have been distributed to our local public health authority partners, as well as our tribal partners, with about 600,000 additional test kits expected in the coming days. And those will be distributed further on to support the partners already receiving tests, as well as our community-based organizations to get to members of their community, and to support efforts to get tests to migrant and seasonal farm workers.
Thank you, Pat. Our next question comes from Fedor Zarkhin with the Oregonian. Go ahead, Fedor.
Hi, thanks for taking my question. I have a pretty general question. Like, how is the current surge different in metro areas between rural Oregon? Do you expect the peak in cases and hospitalizations to come later? And do you expect it to be for the rates to be higher than in metro areas? And if so, why?
Thank you, Fedor. I think based on what we're seeing in other communities and what the data has shown so far during the Omicron surge in Oregon, is some of our urban areas, particularly the Portland metro area, were impacted first by rising cases and saw cases rise faster than much of the rest of the state. I anticipate other parts of the state will see similar increases in the coming days and week. Those numbers may not rise quite as fast or reach the same heights due to the kind of lower population in many parts of the state. While cases in the Portland metro area appear to be leveling off, they are by no means going down. And we need to see over the next couple of days what that trend does in cases to see if our Portland metro area and other urban areas are truly leveling off. We know that as cases spread in more rural areas in Oregon, these are populations that have lower vaccination rates. Overall average age is higher, so the chance of complications and hospitalizations is also higher. And that will likely contribute to a continued steep increase in hospitalizations over the next week to week and a half, with a peak not expected until the beginning of February in those hospitalization numbers. Hopefully our peak in cases will happen before then.
Thank you, Fedor. Our next question comes from, Helen Jung, also from the Oregonian. Go ahead, Helen.
Thanks for taking my question. I'm wondering about the indoor masking rule. I understand you can't extend the existing temporary rule, but why can't you, for instance, issue a new temporary rule as opposed to going the permanent rule route?
I think, under Oregon statute, we can't extend a temporary rule or issue the same rule as another temporary rule following expiration of a temporary rule. So we are going through the permanent process to consider adopting a rule, which is similar to the temporary rule, but has some provisions in there for rescission of the rule in whole or in part as conditions on the ground change. Those conditions would primarily be focused on hospital capacity, percent of hospital beds that are occupied by folks with COVID, and general other indicators that would indicate COVID disease, particularly serious disease spreading in our community. This process is taken to have this rule in place so that this important tool that continues to make a difference here in Oregon on reducing the spread of COVID, but particularly at protecting those who are most vulnerable from COVID is still needed. Because it's a permanent rule does not mean it will be here forever. We will look at conditions on the ground and rescind that rule in whole or in part as those conditions allow.
Thank you, Helen. Our next question comes from Gary Warner. Good morning, Gary, with EO Media. Go ahead. Gary, we'll come back to you. Let's go to Lisa Balick with Coin. Lisa, go ahead.
Yes, good morning. Dr. Seidlinger, you referenced the 500,000 test kits that the state is holding on to refill supplies for the hospital and the schools. But for the public, when they hear that, they're wondering why save these kits, especially right now when the public is in the middle of the peak of the surge and people are desperate to get their hands on these testing kits.
Thank you for that question. Some of these test kits are allocated for ongoing programs that are needed to support staffing needs in hospitals to ensure that staff are available to provide the quality care we all deserve. We can't distribute these kits without redistributing kits and allocating these kits on an ongoing basis because these staff need to test on a regular basis to ensure protection of their themselves, their fellow employees, and the patients they care for. Similar in our K-12 schools, it's disruptive to start and stop programs based on testing availability. So a small amount of these tests, as additional tests are coming in, are maintained to continue to restock those programs. We anticipate about 600,000 additional tests in the coming days that will get out into our communities, that will get out to individuals. And that's on top of the other tests that were already distributed to our communities. So we're getting these tests out as quick as we can and supporting some of the ongoing testing needs that need to be there to provide some stability in our K-12 and hospital settings as we support the staff in those settings as they continue to work and provide critical services during this surge of COVID cases.
Thank you, Lisa. Our next question comes from OPB, Amelia Templeton. Go ahead, Amelia.
Yes, hi. The state's long-term care ombudsman has said now about 75% of all long-term care facilities have a positive COVID case. That's the most of any point during the pandemic. Part of OHA's strategy for responding to Omicron was to try to get boosters to long-term care. How many boosters has the state delivered to residents and to staff there?
Thank you, Amelia. I think I'll have to get back to you on actual numbers of residents that have received a booster in those settings. We tracked information on vaccination rates amongst staff and residents in long-term care facilities. Because of delays in reporting, these reports on our public-facing dashboard often lag by several weeks because data comes in over that time. We've seen very high booster rates in our staff and long-term care facilities following the requirement for vaccine series in those settings, and have seen increasing numbers of boosters happening in those settings amongst the staff. We also continue to see boosters increasing amongst residents, with many facilities having systems in place to get boosters to their residents and staff, and state and our local public health authority partners supporting getting additional staff into those locations. So those booster rates are coming up. They're not as high as we'd like, and we continue our efforts in those settings to get more boosters into the arms of staff and residents in some of the most vulnerable settings with some of the most vulnerable Oregonians.
Can someone follow up with me just on what the change has been since that goal was announced in early December?
We can get you some numbers on what's happened since then, Amelia.
Thank you.
And Dr. Seidlinger, Gary Warner with EO Media has submitted his question in writing. He's having some audio issues, so I'm going to read that question right now. OHSU says Omicron hospitalization peak will be February 1st. That is the first day of the 2022 session of the legislature. Should they be meeting in the Capitol, especially considering the high levels of infection in Marion County? Have you discussed this at all with legislative leaders, and what is the current advice and plan for that? Thank you, Gary.
Thank you for that question. As cases increase across Oregon, many business leaders in other sectors are faced with choices about how to operate their businesses to support the safety of their staff, the customers and clients they serve. The Oregon legislature and the Oregon Capitol have a strong plan for how to manage their operations during COVID. Public health was at the table as that plan was developed, and those leaders will make decisions about how to operate the level of services in person, access to the Capitol, access by the public to the Capitol based on the conditions on the ground, but they have a strong plan in place to protect legislators, their staff, and members of the public as they operate the critical needs of serving Oregonians through the legislative process.
Thank you, Gary. And our next question is a follow-up question from Helen with the Oregonian. Go ahead, Helen.
Thanks so much. Sorry, I prematurely muted myself. So two things. In previous conversations, OHA has said that it could enact a temporary rule, a similar temporary rule on masks without having to wait a specific period of time after the previous one expires. And so I'm wondering, how different would it have to be in order to be valid? Like, could it just be a small change in language in order to qualify as a valid temporary new rule? And secondly, why not give specific benchmarks at which the permanent rule would be rescinded?
Thank you. I'll take those two questions. I will say, the regulations that govern temporary rules in Oregon are put in place so that rules that are going to be in place beyond 180 days go through the usual rulemaking process. So while I don't know the exact kind of language about how much difference a rule would have, we chose to look as the temporary rule for masks was expiring to go through our usual rulemaking process. We engaged several stakeholders, including a rules advisory committee, to provide input onto potential plans and have an open comment period as well as a public hearing to receive comments from members of the general public that will all be taken under consideration before a final rule is published. This process, unlike the temporary rulemaking process, does provide more opportunities for input into the process so that people can see this rule as it takes place. As for benchmarks, I think, we have some general considerations written into the rule for what will be considered for rescission of the rule. As I stated, focusing on hospitalizations and hospital capacity will be key amongst those. Those can impact the ability of our healthcare partners to deliver care to all Oregonians, regardless of whether they have COVID-19 or other things. Picking a specific number is difficult as we are currently still on the rise of this current peak. This peak came on the shoulders of our Delta peak that is severely constrained hospitals. We are relying on contracted staff, Oregon National Guard deployed to staff, so that our hospital partners can continue to provide the quality care that all Oregonians deserve, including those non-emergent procedures that keep people out of pain, that are cancer staging operations and other things that are critical and not superfluous to the individuals who are impacted. When we announced plans for a temporary or for a permanent rule on masks, it was before the Omicron variant had even arrived here in Oregon. And we can see how much Omicron and its devastation across Oregon has caused that wasn't even on our radar screen when this rule was enacted. So to pick a benchmark months in the future of how we're going to be is very difficult. We will look at the impact on hospitalization. We will look at therapeutics and treatments that work and are safe for individuals. We will look at how well our vaccines are working, and we will look at other variants or things on the horizon that could make things worse, and anticipate being able to come up with some more specific benchmarks in the hospitalization and hospital capacity number as we start to come down from this current surge that's driven by Omicron cases.
Thank you.
Thank you, Helen, for that question. Okay, we have another question from Kellee Azar with KATU. Go ahead, Kellee.
Thanks for circling back. So my question is following up on Helen's question as well. Yesterday, we were listening to the public comment being made, and it was very clear. Oregonians that were on there, more than 100, couple hundred, were unhappy with this idea of a permanent mask mandate. One of the biggest things I saw is a lack of trust. They said they didn't trust that you guys would come back in a timely fashion when things do start changing in our areas or in our state. What assurances can you give Oregonians out there that this won't be forever and ever?
Thank you, Kellee. Let me start by reiterating my gratitude. The vast majority of Oregonians, while we do not like wearing our masks, continue to wear masks, and wearing masks in public places has had a great impact on COVID-19 here in Oregon, with some of the lowest cumulative case rates and death rates here in the country. I want to thank the Oregonians who spoke very passionately yesterday about masks, shared their personal stories about the impact on them, and their comments will be heeded. I will make the promise that I've made before that we will respond to conditions on the ground with an equity focus to ensure that we can provide protection across Oregon, and particularly to communities most impacted by COVID-19. We currently have very few statewide requirements in place for COVID-19. The tiered system of impacts on businesses with capacity limits, spacing, and other things have gone away, and it has not come back even in the face of increased surges because we have additional tools. Vaccines and boosters, our high vaccination rates, the number of Oregonians, over 400,000, even since the governor issued her challenge at the end of December, have been boosted. Those tools are making a difference. Wearing masks in indoor places are making a difference. We do not have capacity constraints on businesses or limits on when or who they can serve, as we did early on in the pandemic, because we have these additional tools. It is now the virus that is impacting those businesses. It is now the virus that is forcing those hands and oftentimes forcing closures, whether it's short-term remote learning in schools, our local businesses who have too many staff out sick to be able to provide the services they need to their clients, professional, collegiate, and other sports events being canceled, travel being disrupted because of that. That is the COVID virus. That is the SARS-CoV-2 virus impacting that, not state requirements. So as we responded with tools that were available to us to best prevent the spread of COVID-19 and maintain hospital capacity for all Oregonians in the past, we will continue to do so with the mask mandate. This is a fairly common sense step that we can take that has helped to save thousands of lives here in Oregon, and we only want to use it as long as it's making a difference. We need to get through this current surge with cases still continuing to rise in a very rapid fashion of Oregonians who woke up in the hospital. Over 1,000 Oregonians woke up in the hospital today with their families worried about them, with several of them likely not going to make it out of the hospital. And those tragedies can be prevented when we all come together, take steps to protect ourselves, our neighbors, and our loved ones. And hopefully by doing that, continuing to do that as the vast majority of Oregonians have, we will come down out of this surge quicker and with less loss of life.
And then my last question for you on testing is, you've mentioned that, sending tests to certain areas because of equity reasons, and also having those testing sites there as well. Can you go into a little bit more specifics as to what you're looking at when you're deciding where these tests go and testing sites go, particularly, what are those, I don't want to say benchmarks again, but what are those kind of flags for you guys that say, oh, we need more testing here?
Thank you for that. We look at things like communities that have been harder hit geographically, or some of our communities of color that have had higher rates of disease, have reported more difficulty accessing testing, either because of mistrust or a lack of geographic access. So physically, we try to locate testing facilities in sites that traditionally haven't had close geographic access to a testing facility in more urban areas, to try and ensure that those are accessible via public transportation so that those without a car can still get to those tests. And throughout much of this pandemic, we've had some contracts and very strong ties with community-based organizations who know their communities, who know who the leaders are and how to get information out and how to get services out into those communities. They will serve as another avenue for us to deliver home tests into communities, to get them into the hands of individuals who, for various reasons, whether geographically, lack of trust, or other reasons, have not been able to access testing for this, but have tragically been disproportionately impacted. Those community partners, those local public health partners, will be able to get vaccines or get test kits into those communities to get them into the households of members who need them most. And then we have other avenues, whether it's retail distribution, our community testing sites for state vaccination sites. We often have testing available by appointment as well, healthcare provider appointments, pharmacy appointments, and now the federal direct distribution to households. We have multiple avenues now for people to access testing, and we have multiple strategies to make sure that some of our state-directed tests get into the communities that need them most.
Thank you, Kellee. Our next question comes from Kandra Kent from KPTV. Go ahead, Kandra.
Hi, good. Thank you. I hopped on here a little bit late. I apologize. I hope this question hasn't been asked yet, but my question has to do with hospital capacity. And I wanted to know, what can the Oregon Health Authority or the state do to help out with capacity issues that don't necessarily have to do with COVID-19. I'm talking about the staffing shortages. And then we're also hearing from a lot of hospitals that there are people hospitalized that should not be in the hospital, but they just can't discharge them. So I just wanted to know, what's in the works to help on that front.
Thank you, Kendra. I think, Oregon Health Authority, our local partners and our healthcare partners have been doing multiple things together to support hospital staffing and to support trying to increase capacity in hospitals. So Oregon Health Authority has contracts with several staffing agencies to provide staffing directly to hospitals, to provide clinical care and support care in those settings, to either increase capacity or to make up for some of the staff who are out because they're ill and impacted by COVID. The Oregon National Guard has been redeployed to hospitals in non-clinical settings to help support the care that's given there and to reduce wait times and allow hospitals to provide care to more individuals. We have worked with several non-hospital partners to provide decompression units or a COVID recovery unit where patients who are ready for discharge from the hospital but don't have a location to go because they need some additional care can be discharged to. There are still patients in the hospital who can be discharged, and we continue to work to try and identify additional beds for those patients to be discharged to. Those are several of the measures we've taken. In addition, with some of the home test kits that were received by the state, those initial batches, many of them went to our hospital partners to distribute to their clinical staff who are critical to providing the high quality care that Oregonians deserve in hospital settings. Tests allocated for our healthcare partners in those settings to do 2 tests per week so that they can test and return to work as quickly as possible when they've recovered from COVID, or to assure that they don't have COVID based on an exposure. We know our healthcare partners have done an amazing job in providing testing to their staff to ensure a safe environment in their hospitals. And this home testing option is providing another benefit during the surge when COVID is so much more common, exposures are so much more common, to keeping those professional, tired, and dedicated staff on the job.
Thank you for that question. And just a reminder, if you have a question, please raise your hand. And if you've asked your question, feel free to lower your hand. We have a follow-up again, follow-up to a follow-up again from Rachel Monahan. Go ahead, Rachel.
Hi, thanks for taking another question. So I have a couple of data questions. One is, do you have a sense of how long tests are taking to come back right now?
I do not have a look into the length of return on PCR tests at this point.
And how about with the hospitalization data? Do you have any sense of this peak versus or this surge versus other surges, and how many cases are incidental cases discovered in the hospital versus hospitalized for COVID or related to COVID, this surge versus Delta or previous surges?
Thank you, Rachel. I think what we're seeing, what we're hearing from our clinical partners and what we're seeing in this surge is similar to other surges. Whereas case numbers go up, that the number of incidental cases go up. I would anticipate, because this peak is much higher and has gone up much quicker, that there might be some more incidental cases. Those individuals, even if their primary diagnosis is not COVID, COVID is often a contributing factor to their diagnosis. And we've heard from our healthcare partners that makes up the vast majority of patients in those settings. We also know that those patients still need staff to care for them, still need personal protective equipment to protect fellow patients as well as those staff. So are still taking up similar resources. What is really heartening about this current surge in hospitalizations is the lower percentage of folks needing specialized care from an intensive care unit or on a ventilator. So while there are large numbers of patients still requiring hospitalization with COVID here in Oregon. There are not the same percentage of folks needing that intensive care level of care. So that's a glimmer of hope as we face one of the steepest increases and one of the highest peaks that we've seen so far during COVID.
Thank you so much for those really good, thoughtful questions. Our next question is a follow-up from Amelia Templeton. Go ahead, Amelia.
Yeah. Can you speak more to what data points would be appropriate to consider as part of lifting a mask mandate, and whether or not OHA is committing to, if the state reaches a certain threshold for hospitalizations or for boosters, lifting that mandate?
Thank you. Amelia, I don't have specific data points or thresholds that we need to reach. As I've stated before, having hospital capacity available to care for anyone from Oregon who needs that care, whether from COVID, after a heart attack, or a car crash, remain critical points for us. The number of folks with COVID who are occupying a bed at any given time is one contributor to that. The capacity that exists for hospitals to provide care for anyone who shows up at their door is another piece of that, including their ability to provide specialized care like intensive care for patients who show up. Those are things that will play into guiding our decision to raise or rescind the mask rule in whole or in part. Things that play into those numbers are things like the spread of COVID in the community, the availability and effectiveness of our vaccines. Our current vaccines remain highly safe and effective, and those who've been vaccinated and boosted when it's their time after their vaccine have great protection, not just against infection, but even better protection against being hospitalized. We have oral medications, antiviral medications that are right now in very short supply, along with monoclonal antibodies to treat some of those who are most vulnerable for complications. Those are in short supply. We'd want to see those kind of therapies in broader supply so that we can treat the folks who and prevent complications rather than need them to take up a hospital bed long term. So we're going to look at things like that, focus on hospitalizations and the ability of our hospital partners to provide care for everyone, to set out some data points that would go into rescinding this rule in whole or in part. But right now, with cases in hospitals surging above 1,000 for the first time since our Delta peak and continuing to rise at an uncomfortably fast rate, we need to keep working together, wearing our masks, limiting our gatherings with others during this time that COVID is surging, and getting vaccinated and getting boosted if we have it. These are tools that have helped us in the past, that have helped save thousands of Oregonians' lives, and will save thousands, will continue to save lives as we go through this peak.
Thank you for that question. We have a follow-up question now from Fedor Zarkhin with the Oregonian. Go ahead, Fedor.
Hi. So right now, there's a lot more children hospitalized with COVID-19 than during prior peaks. Like the peak hospitalizations at this point are already higher than they have been in the past. Do you know why that is?
Thank you. Yeah, we are seeing increased number of hospitalizations. Some of that is just driven by the numbers. As more people get sick, more children are going to get sick. But what we're also seeing that's similar to adults is that children who are unvaccinated who are more likely to be hospitalized than children who are vaccinated. We've seen in data from a surveillance study that Oregon participates in called COVIDNet that Dr. Walensky at the CDC reported on the other day. We're seeing a surge in cases of hospitalizations amongst children 0 to 4. These are children who are not yet eligible for vaccine, so are not vaccinated. In addition, this Omicron variant, while it causes less severe disease in adults, we're seeing less lung disease and more impacts on the upper airways. Children, particularly young children, are more impacted by viruses that impact their upper airways and can be hospitalized or require hospitalization for things like bronchiolitis, that inflammation and infection in the upper airways. So lack of vaccination, more impact on the upper airways, more disease in general in the community. Those three things together are leading to this dramatic increase in cases pediatric patients, not just in Oregon, but across other states as well.
Thank you for that follow-up question. We have an additional follow-up from Lisa Balick. Lisa, go ahead.
Yes, thank you. My question is just relative to the people that are in the hospital right now. Some of the states are giving out the numbers of, in other words, how many are in the hospital specifically being treated for COVID. In other words, they came in the door with COVID and that was their main reason why they're there, compared to those who were there for other reasons, but then were diagnosed with COVID while there. So in other words, out of that, approximately 1,000 people that are hospitalized right now, what's the split?
We don't have that information on incidental hospitalizations in Oregon and those who are hospitalized primarily for COVID. But what we're hearing from our clinical partners is most of the patients who are hospitalized are either hospitalized because of COVID or COVID is a contributing factor to their diagnosis.
Thank you for that question, Lisa. And Dr. Seidlinger, that actually was our very last question. I want to remind all of our media friends that this will be hopefully included before 2 o'clock. We do note your broadcast deadline, the link to this recording. Dr. Seidlinger, not sure if you had any closing remarks.
Yeah. Thank you, all of you, for those thoughtful questions and allowing us, helping us to get the word out. This is a tragic time for Oregon with case numbers at their highest and hospitalizations approaching some of the highest levels here in Oregon. So my thoughts go out to all of the individuals impacted with relatives in the hospital, relatives who are sick or who are sick yourselves. I hope that all Oregonians continue to take steps to protect themselves, loved ones, and communities as we have throughout this pandemic. Oregonians have shown throughout this pandemic that they've come together to fight off this virus, and that has contributed to our relative success to other states, even though in the midst of a surge, this may not feel like a success. So if you have not yet been vaccinated, please get vaccinated, get your questions answered about the vaccine. If you're eligible for a booster, get your booster. And during this time of surge, let's all continue to wear a mask when we're in public places around others to protect ourselves, the loved ones we come home to, as well as those we come into contact with. And let's consider changing our plans during this time when COVID is spreading so quickly so that we can reduce the spread, protect our hospital capacity so that those dedicated workers can provide the care for all of us should we need it. Thank you.